This presentation on impacting co-occurring mental health and substance abuse use disorders with nursing interventions is by Barb Van Donsleer, Sarah Johansson, and Tessa Staub. Vulnerability is defined as susceptibility to harm resulting from an interaction between the resources available to individuals, communities, and life challenges they face. Vulnerable populations are a subgroup of the population that is more likely to develop health problems as a result of exposure to risk and to have worse outcomes from health problems than the rest of the population. Psychiatric disorders often occur with substance abuse disorders. Many health needs exist in this vulnerable population, and the goal of this project is to shed light on awareness and what we as nurses can do to care for these individuals. Those living with the co-occurring disorders can be from all walks of life and all age groups, although various disorders have prevalence rates that differ by gender, race, age, and ethnicity. The coexistence of both a mental health and a substance use disorder is referred to as a coexisting disorder. When left untreated, undertreated, or undiagnosed, it can lead to increased levels of homelessness, incarceration, medical illness, suicide, or early death. With the large population this encompasses, this presentation will focus on the adult population living with mental illness and substance abuse. The population is vulnerable for many reasons. One of them is the use of a system of fragmented care. Each area has its own operations, its own billing, its own culture and priorities, and a person trying to seek help is often lost amongst them as each center overlooks questions such as, what are the full array of needs that must be addressed to make this person healthier and put him or her on a path to well-being? Also, just because a person has insurance does not mean that the system will work. In a report conducted by the National Alliance on Mental Health in 2015, their findings concluded nearly a third of survey respondents reported insurance company denials of authorization for mental health and substance abuse care, among other issues. Throughout the review of literature, the larger part of the issue that appears to make this population vulnerable is that this population often lacks access to health care, social support, knowledge of available resources, and how to care for themselves. The people living with the co-occurring disorders of mental illness and substance abuse trend toward a population with limited access to the help they need. How can we overcome some of these barriers to reach those who need it? There are several determinants of health that impact this population. Some of the barriers include not being able to make a living wage and lack of job opportunities, or the social environment that this population may be in. The place of residence, or lack thereof, is not helpful for stability either. This can be a very poor situation for the population. Transportation may become a problem. They may also be dealing with racial injustice and discrimination, access to drugs and alcohol, chronic health issues, poor social support, poor nutrition and lack of resources to meet daily needs, as well as there can be low self-esteem, cognitive or emotional immaturity, or difficulty communicating that can leave this population being underserved. It appears there may also be a genetic predisposition as well. It is estimated that 40 to 60% of an individual's vulnerability to addiction is attributable to genetics. An individual's mental health state can also be influenced by genetic and biologic factors. When we look at the idea that similar pathways in the brain and areas of the brain are involved in both disorders, there can also be an environmental impact, a state of impoverishment, disorganized neighborhood situations, and emotional isolation and rejection. The behaviors of this population also vary greatly. Some people are seeking treatment, but don't have the means or are encountering barriers in insurance, and that's one end of the spectrum. At the other end are the people who don't want help. They seem to be okay living their life on the streets, going from one high to the next, from one food bank and shelter to the next, and not wanting or seeking help of any kind. The statistics and issues with mental health and substance abuse are staggering. This leads to our nursing diagnosis. Risk for ineffective coping among adults with mental illness related to knowledge deficits, lack of access to care, and impaired social support, as evidenced by use of substances to control symptoms. In 2014, 7.9 million adults in the United States had a co-occurring mental disorder and substance use disorder. Of the 40,000 people in the Sioux Empire that have mental illness, it is estimated that the majority of them also suffer from co-occurring substance abuse. We have identified 3 major health needs regarding this population. The first one we have identified is education. Education regarding available resources is essential. The teaching of importance of medication adherence, adequate nutrition for optimal brain and body health, as well as proper coping skills when life gets tough and knowing when it is important to seek help. The need for education does not stop at the level of the patient. Teaching for healthcare providers is also essential regarding assessment and warning signs of mental health problems. Our second need identified is lack of access to care. While some individuals qualify for Medicare or Medicaid, it can be difficult to obtain for those who lack skills to fill out an application or simply get to the Department of Human Services due to lack of transportation. Many whose income is just over the limit for governmental assistance cannot afford private insurance. Counseling services often offer sliding scale pricing, however paying anything at all can be a hardship for most people. And also, as was mentioned earlier, individuals who are insured also have their own set of problems with access to care. Another barrier which decreases access to care for those with co-occurring disorders is the shortage of psychiatric physicians. With burnout being a major issue, appointments and referrals get pushed out for months, leaving people in a very dangerous state for too long. Our third need identified is the need of social and spiritual support. More often than not, these individuals have burned the bridges of support they once had. Social support has a profound impact on individuals who suffer substance abuse, as well as spiritual support is a vital component of holistic health. This community does have some strengths and resources towards meeting these health needs. The Sioux Empire area is abundant in resources for adults who are mentally ill and chemically affected. However, out of 32 counseling agencies in Sioux Falls, only 3 of them specifically treat individuals with co-occurring disorders. A handful of the agencies are religion-based, offering an increased level of holistic care. In addition to outpatient services through counseling agencies, the Sioux Falls area also has inpatient residential recovery options, also known as recovery homes. The Oxford House, which is a self-run publicly and self-supported nonprofit agency that provides inpatient treatment for men, women, and women with children in various homes. The Glory House is another residential recovery program. They provide Christian counseling, resources, and support to men and women who have been incarcerated and are trying to re-enter the community. Many of their clients struggle with mental illness and substance abuse as well. Southeastern Directions for Life provides support and education for adults with severe mental illness in the hopes of preventing hospitalization for their clients. Specific services offered include finance management, social support, employment opportunities, healthcare management, and links to professional counseling. The National Alliance on Mental Illness, a national program with a location that serves the Sioux Falls area, provides education to individuals, families, and the community regarding mental illness and substance abuse problems in the form of presentations, workshops, and a referral phone line for people with co-occurring disorders. Double Trouble and Smart Recovery are 2 programs offering 12-step recovery and support for individuals as well. A resource offering spiritual guidance as well as linking of resources available to this vulnerable population is the Center of Hope. Led by pastors as well as community health nurse Madeline Bora, Center of Hope ministers to people in need by sharing hope and peace in Jesus, physically and spiritually. With co-occurring conditions being so prevalent in the population, it is imperative that action is taken to prevent, identify, and provide assistance to individuals with mental illness and substance abuse. Screening in the primary care office for behavioral health conditions will be the first step in addressing this population. The additional screening would assist in identifying individuals with the condition sooner so earlier interventions can begin. Providing education to those suffering from co-occurring conditions as well as the general public will help to provide the understanding of what is to help raise awareness as well as to help decrease the stigma. Furthermore, better access for these individuals is extremely important and would also need to include steps to eliminate barriers to receiving care, which can be related to transportation, finances, and lack of providers. Ensuring family or community resources are available to provide support will increase the likelihood of success for individuals who receive treatment. We have identified primary, secondary, and tertiary interventions directed towards this population as well. Primary prevention focuses on developing interventions to prevent a condition before it occurs. Education will be an important part of this prevention of co-occurring conditions. Educational programs should be developed and implemented for high-risk populations, as well for children, to provide teaching on identification of stressors, stress reduction skills, as well as healthy coping skills. In order to reach the population, an approach would need to be taken to provide the information in multiple ways, which would include programming in the schools, posters out in the community, and radio ads along with collaboration with support groups and community resources that provide either behavioral health or substance abuse assistance. Secondary prevention assists to identify and decrease the impact of a condition. Within this area, it is important for screenings to start early for those that are not diagnosed. Madeline Bora says it would be important to begin behavioral health screenings as early as Head Start. Due to the stigma associated with behavioral health diagnosis, this causes delays in diagnosis as well as treatment, which can in turn lead to the use of substances to help manage an undiagnosed condition as a child gets older. A nurse should complete a spiritual assessment as well to identify the specific spiritual needs of the individual, so resources can be included in that plan of care. In addition, as a nurse, both depression and anxiety screenings, as well as a more encompassing screening such as the GAIN-SS, would help to identify individuals with co-occurring conditions in all clinical settings, as well as part of the service and screening provided by community resources and other ancillary services like home health and faith community nurses. With a positive screening, it then becomes important for an individual to have early access to treatment. This also would address any issues related to transportation and be coordinated to ensure the individual is able to get to their appointments. Financial barriers should be evaluated to determine if this is preventing the individual from receiving care or prescriptions, as well as medical coverage for treatment is also to be assessed to eliminate financial barriers. The focus on tertiary prevention is to ensure the condition does not worsen and to prevent a relapse from occurring. Tertiary prevention would focus on assessing and connecting the individual to resources to assist in both providing spiritual and social support, adherence to the treatment plan, ensuring a good self-management plan for the individual, as well as understanding the signs that they are having a relapse, so additional services and interventions can be implemented. A clear plan of care would be established, and then providing continued education on the importance of adhering to the treatment plan as well as medication adherence are essential for success and will allow the individual to feel they have more control over their situation. Additional resources for medications like timers or pill boxes could be used, as well as education if medication adherence is an issue. Signs for potential relapse should also be monitored for, so resources like counselors or support groups can be brought in. A support system for the individual as well as for family of the individual should be in place as well. Our action plan then includes preventative education for the community, medical, behavioral health, and substance abuse services provided in one location for continuity of care and easier access for the patient. Partnership and collaboration with community resources, including Center of Hope, Face It Together, Double Trouble, and Smart Recovery. Contributions to the population would include earlier diagnosis, treatment, and understanding of the treatment plan leading to better adherence, elimination of any barriers, and then decreasing the stigma. The interventions outlined above also address some of the Healthy People 2020 goals related to these areas, such as increase the proportion of persons who need alcohol and or illicit drug treatment and receive special treatment for abuse or dependence, and increase the proportion of persons with co-occurring substance abuse and mental disorders who receive treatment for both disorders. We do see some future needs that need to be addressed. Individuals may experience unwillingness to change. Techniques like motivational interviewing may be useful in order to get an individual to open to change. Also, the lack of available providers as well as appointments with providers is a current barrier and will likely continue. There is a lack of current enrollment in psychiatry programs. And there is also has not been growth in enrollment in psychologist or social work programs. There is also a lack of coverage in South Dakota for the working poor that may cause a financial barrier, which prevents individuals from seeking services. This provides an opportunity for nurses to advocate in legislature for additional coverage, like expansion of Medicaid coverage in South Dakota, and to look for additional state assistance with programming. In summary, individuals with co-occurring conditions are a vulnerable population where nursing can have an impact. By identifying their needs through assessment, the nurse can assist in coordinating care and resources to ensure all of the health needs for the individual are addressed and the necessary support is in place to help them be successful in the management of their health. Thank you.